welcome back to my channel. If you're not already subscribed, make sure you hit that subscribe button and turn on post notifications so that you never miss a video. Today, we're going to be talking about what is global regulatory affairs. Now, I've made 2 or 3 videos now on what is regulatory affairs. The first video I made is the notorious video that has all that sound in the background when I just started out on YouTube and I didn't understand that elevator music couldn't be louder than the sound of my voice, but now I've since gotten better. And then I made another video about what is regulatory affairs, and I think I made 1 or 2 more. But the video that continues to get the most traction is that first regulatory affairs video. So instead of making another what is regulatory affairs, I've decided to make a what is global regulatory affairs. It's not going to be that different to the videos that I've made before, but I will be talking about different health authorities in different countries. So if you're interested in understanding what is global regulatory, make sure you stick around and watch the entire video. Just to reiterate, if you don't know what regulatory affairs is the science and art, in my opinion, of obtaining government approval for certain products. That can be for medical devices, that could be for biologics, it could be for small molecules, something like a tablet. If you don't understand what a small molecule is, Advil is a great example, or it could be for a cosmetic. But in this case, and for the basis of my channel, I normally stick to biologics and small molecules because that's essentially what I work on. And a biologic, for those who may not know, it could be a vaccine. It's essentially something that might go in a vial or go in a syringe. There are varying types of biologics, but those are just the easiest examples in case you're not sure what it is. So regulatory's responsibility is to get these various products approved and to also maintain those approvals. Now, just because you get an approval in the United States doesn't mean that your drug is approved in China or Singapore or Japan or the European Union. Somebody in regulatory has to take that approval and now translate it over to different countries depending on what the various strategies are for your organization. Now, different companies have different ways they structure things out. You may see a USRL, which is a United States regulatory lead. You may see an ERL, which is a European regulatory lead. You may see a GRL, which is a global regulatory affairs lead. Normally, a USRL will report to the GRL because the GRL will have like different products assigned to them and be responsible for those products and those studies in all different parts of the world. And the reason why it's important to have a GRL is because the GRL has the bigger picture. They're saying like, okay, if I have an IND, maybe I want to take my IND right now and convert it to a CTA so that when we're going towards getting our NDA, it'll be easier for us to acquire an MAA. If you don't know what those acronyms are, go ahead and look at my other videos. I don't think I've ever defined what a CTA is or an MAA is. Essentially, a CTA is equivalent to an IND. In Europe, it's called a clinical trial application. An NDA or BLA is equivalent to an MAA in the European Union, which is a marketing authorization application. The GRL will come up with different strategies for why they want to do things, why somebody would do an IND, not do a CTA at the same time. I don't know. Everyone has different strategies, but that's essentially what the global regulatory affairs role will be thinking about. The product development strategies and maintenance of these various applications across multiple regions. The GRL may also look into expanding into other regions like LATAM, which is Latin America. Also may be interested in expanding into the JPAC region, which is Japan, Asia Pacific, and China, if they're only in the EU and they're only in the United States. Or they may look into going into sub-Saharan Africa. There are different things, again, that a global regulatory affairs lead comes up with. As I said in other videos, regulatory is involved in everything, okay? You're involved from the preclinical stage all the way up until commercialization and maintenance of the application. In some ways, I really do see it as practicing law. And the reason why a GRL is very important is because a GRL, or a global regulatory affairs professional or lead, needs to be well-versed in the different regulations across these different countries. And that's a really big responsibility. So it can be hard for a GRL to maintain applications single-handedly across different programs if they don't have a USRL or an ERL, but they do need the assistance from those country leads. Just because a product is approved in the United States doesn't mean the European Union is going to approve it. Also, getting a marketing authorization is not the same as getting an NDA or a BLA approved, especially for the simple fact that some products have to go country by country for their approval in the EU. There are certain products that can go the centralized procedure, but there are other products that have to go the decentralized procedure. A GRL needs to manage that and needs to also go to the business operations people or whatever in their organization and talk about, look, we got notice back from the EMA, the European Medicines Agency, that we have to go the decentralized procedure, which means we have to go to each country by ourselves to seek these approvals. Do we want to do that? Do we want to just focus on the countries that have the highest incidence? GRL will work on those different regulatory strategies. So the GRL is always staying well versed in understanding how to seek approval in the different countries. And while a GRL may not know all the guidances for all these different countries, a lot of people who work in global regulatory affairs have, at least for the basics, I would say top 3 are going to be European Union, United States, and Canada. The reason why I also think there's a huge difference between a global regulatory affairs professional and just like a US professional or just a Canada professional or just a EU professional is how you engage with these health authorities is going to be very different. Engaging with PMDA, in my experience, was so different in comparison to engaging with the FDA. That's because there's a lot of cultural aspects to these different health authority bodies that may shock someone who's only had FDA experience. I myself have worked in the JPAC region. I don't really have LATAM experience, but being able to work in the JPAC region as well as the EU and Health Canada, I feel it would be easy for me to translate my international regulatory affairs skills into any other country just because I've had experience into other countries. How I got that experience was, of course, starting out in US regulatory affairs, working with the FDA, and then one day the program I was working on, we were expanding into Canada, and then I got Health Canada experience, and then I got an opportunity from having US and Health Canada experience to work in global regulatory affairs for a really large company, and that really large company had a bunch of clinical trial applications in the EU. So you kind of get to build off of your experience. Once you start with one regulating body, it's really easy to branch into global regulatory affairs by just like being in an organization that has studies across the globe. Now, just to educate people on what different health authorities are called, it's so funny to me because some people will be like, oh yeah, the South African FDA. That's not what it's called. In the United States, it's called the FDA for the Food and Drug Administration, but that's not what all countries will just call it. For example, in Canada, the equivalent of the FDA there is called Health Canada. In the EU, the equivalent of the FDA is called the EMA, the European Medicines Agency. For Nigeria, it's called NAFDAC, which is NAFDAC. Singapore is HSA, China is NMPA, and Brazil is called Anvisa. So all these countries have different names for their health authorities. If you're curious for a specific country, like you want to know what Vietnam's FDA equivalent is, you can actually just search in Google like FDA equivalent Singapore, FDA equivalent Vietnam, FDA equivalent Bahamas, whatever country you're interested in. I personally love global regulatory affairs. I think once you've mastered your own country's regulations, it's really interesting to branch into other countries and kind of see how they go about the approval process. I remember when I first started working with the European Medicines Agency and getting well versed in how they do things. They are like a well-oiled machine. And I also found it really interesting because I personally think, in my opinion, one of the strictest health authorities is the European Medicines Agency. I think the FDA is a little bit more lax with a bunch of things, and we've seen that like with how food is regulated in America. There are a long list of foods that the FDA allows, whereas the European Medicines Agency is like, not a chance. I've been on calls with the EMA and they're very cut and dry. Of course, it depends on who you get or who's reviewing your application. Just to make the video a little bit more concentrated, what are some bullet pointed things that someone in global regulatory affairs would do? Some things that you would do, of course, is you would develop various regulatory strategies. You would likely be involved in decision making as it relates to like the probability of regulatory success going into different countries. You would develop local and global regulatory goals. And of course, you're gonna do, I mean, it's pretty similar to like what regular regulatory responsibilities will be. You'll probably be involved in like the writing of submission documents. You'll represent the organization at health authority meetings. I don't know, it depends on what different companies will do. Some companies will only let the GRL go to health authority meetings. Some GRLs are really cool and will give the opportunity, like if it's an FDA meeting, they may let their USRL go to that meeting. If it's an EMA meeting, they may let their ERL go to that meeting. They may, if they have a country specific person, they may allow allow that country-specific person to engage in that meeting. And that GRL, of course, is going to be responsible for managing those people. When health queries come in from different countries, it'll be very important for the GRL to be involved in those response processes, especially because you want to make sure your response, if it's the same from different countries, is streamlined across all those countries. That's basically it. I mean, there's so many global regulatory affairs jobs out there. Just go on LinkedIn, Indeed, Career Builder, and type in global regulatory affairs, and I guarantee a bunch of opportunities will come up. You'll also see the job description for those various titles. It's going to vary across different organizations. I hope you found this video useful. Thanks so much for watching, guys. Bye.